Hello, everyone, and thank you for joining us today for the Office of Community Living Update webinar for providers. My name is Jennifer Larson, and I am the training coordinator for the Office of Community Living. Just a reminder that we are recording with the intent of posting it on our website, so please be cognizant of sharing any personal or protected health information during the meeting, either verbally or in the chat. Our team is managing questions in the chat panel, so please type those in as you have them. A copy of today's slides are available on our website, and we will add a link to those in the chat for you so that you will be able to download them. If you're listening by phone only and not in the video portion of the meeting, you can still participate by pressing *6 to mute and unmute your phone, or press *9 to raise and lower your hand to be added to the queue. And Zoom does provide closed captioning, so if you click on the live transcript or CC button at the bottom of your screen, you can either turn that on or off. And now I'll turn it over to Colin to start off the presentation.
Thank you, Jen. Welcome everyone to the Spring Forward Week that this morning certainly did not feel like spring forward, but appreciate you all joining us today. We do have a busy agenda with several guests, so I'm going to dive right in. As always, please employ the chat if you have questions. Our team is standing by to answer those, and I'll certainly take opportunities throughout the presentation to answer when I have a moment. So with that, if we could go to the agenda, please, Jen. All right. We are going to have Ellen Jensby on, who's going to speak a little bit to the Developmental Disabilities Awareness Month. A lot of really cool stuff happening there. And then we are going to have Kate Kirkman's on, who is the President and CEO of the Brain Injury Alliance of Colorado, to talk about Brain Injury Awareness Month, which also happens to be March. Some really cool stuff they have going on there. Going to have some guests come on to speak about the end of the public health emergency and what that means, the unwind process, a lot of communication plans going on around that. We'll also have Amanda and myself speak to a little bit more of the OCL related things, the Appendix K, case management, some of that. And then take a moment to reflect and sort of give updates on the final settings rule. Tomorrow is a very important date for the state of Colorado and frankly, nationally about where we're at. So we'll take some time to talk about that. And then I wanted to give you all a budget and legislative update. I think I have some good news for you all regarding rates. I know some of you may have heard, but wanted to get everyone caught up as to what was going on. And then just a couple housekeeping items, including 2 surveys, one that is already live and one that will be live shortly. So you all have the opportunity to send that to your networks, and hopefully we can get some really good data around those. So with that, I'd like to turn it over to Ellen Jensby, who's here to talk a little bit more about Developmental Disabilities Awareness Month. Ellen?
Thanks, Colin. Good afternoon, everyone. My name is Ellen Jensby. I'm the Senior Director of Public Policy and Operations for Alliance. For those of you who may not be familiar with us, Alliance is a statewide nonprofit association of program-approved service agencies, community-centered boards, and we also have advocacy partners as well as strategic corporate partners as part of our membership. So Developmental Disabilities Awareness Month, of course, is happening in March. It's been an annual event since 1987 when it was first proclaimed by President Ronald Reagan. And of course, the purpose is to raise awareness about the inclusion of people with developmental disabilities in all facets of community life, as well as the barriers that they still sometimes face. On the right side of the slide, you can see the artwork that was selected to represent this year's Awareness Month and the theme Beyond the Conversation. If you'd like to learn more about that, I think Google or your preferred search engine can help you out. But here in Colorado, we've already kicked off the month. And if you'll move to the next slide, we'll talk about the remaining events we have coming up. So on March 1st, as I mentioned, we kicked off the month with the first annual Disability Rights Advocacy Day at the Colorado Capitol, and we will close the month on March 29th, again at the Colorado Capitol for Intellectual and Developmental Disabilities Awareness Day. This is an annual event that is jointly hosted by us at Alliance, the ARC of Colorado, and JFK Partners. We're so excited this year to present both in-person and virtual options for people to attend. The day kicks off formally at 9 a.m. with a Pledge of Allegiance led by people with lived experience with IDD in both chambers, and then each chamber will do a IDD Day tribute. We don't know exactly when that will happen, but sometime that morning. At 10 a.m., we'll stream live our policy webinar to keep you up to date about pertinent bills that are moving through the legislature this year, as well as budget actions. And then at noon, we'll stream our virtual luncheon, which includes a variety of speeches, including our Legislator of the Year, Representative Mary Young, and the 2023 Direct Support Professional of the Year Award. You can find more details and how to join at the website at the bottom of the slide there. And then finally, I just wanted to give a plug, if you'll move to the next slide, please. This year is Alliance's 50th anniversary as an association, and we have several events coming up this summer, June 23rd and 24th in Denver. The first of those kicks off at the Denver Zoo. We wanted to have a fun, family-friendly, casual event. So that'll be happening the afternoon of June 23rd at the zoo. And then after that, we'll follow with our annual IDD Community Awareness event at the Colorado Rockies, which is always a good time. You can get discounted tickets to that game, as well as the next day, tickets to the Colorado Rapids game. So visit the webpage there at the top of the slide to get more information about how you can attend. We hope many of you will join us. That's it for me. Turn it back over to you, Colin. Thank you.
Thanks so much, Ellen. A lot of great events going on, a lot of really cool opportunities to get engaged. So thank you for sharing. With that, I'm going to turn it over to Kate Kirkmans, who is with the Brain Injury Alliance of Colorado, to talk a little bit more about what they're doing for Brain Injury Awareness Month here in March.
Thank you, Colin. Thank you all for having me. Happy to be here. Yes, so March is also Brain Injury Awareness Month, so busy month full of awareness, which is great. The Brain Injury Alliance of Colorado, for those of you who aren't familiar, we were established in 1981. We serve all Coloradans impacted by a brain injury statewide. We provide a number of services. We do resource navigation, skill building programs, classes and workshops, adaptive recreation, peer mentorship, mental health, counseling. What am I forgetting? Probably quite a few things, but we have lots of different services all outlined on our website, which Max just put in the chat. Thank you for that. One of our big projects at the moment, if you want to go to the next slide, is called Valor on the Facts. We started this project about 4 years ago, and we're set to open our doors for our first residents next week. This is a permanent supportive housing complex for people experiencing chronic homelessness, as well as folks who have a brain injury or related disability. As far as we know, it's the first of its kind in the nation, so we're really excited about it. If you want to go to the next slide, please. These are just some of the details. It is 1, 2, and 3 bedroom units, so we'll have some families there as well. It comes fully furnished. The Brain Injury Alliance of Colorado will be staffing the building 24/7 to provide services to folks on site. All of those services I mentioned earlier are available to everybody at Valor as well. And as I mentioned, we are all set to have our first residents coming in next week. So we're really excited for that opportunity. One of the things that's really different about this program that I'm excited to see how pans out is because we've been able to be involved from the very beginning of the planning for this building, we've been able to design and decorate the entire building with a trauma-informed lens. So not only services, but the actual architecture of the building, everything down to the furniture, has been through the lens of trauma-informed design and trauma-informed care. So really can't wait to see sort of how the long-term outcomes for some of our folks are impacted by those elements. Next slide, please. We have a few activities going on for Brain Injury Awareness Month. We had our first sign out to donate last night, which was a great success. We're going to do another one on Thursday, March 30th at the Sloan's Lake Tap and Burger. Anyone can come, please come out, eat, drink, and 20% of all of the proceeds from that night will go to the Brain Injury Alliance. On Sunday, April 2nd, we're going to be having a private screening of a documentary film called The House We Lived In. It's made by a documentary filmmaker whose father suffered a traumatic brain injury. And so he kind of filmed his family's journey through that process. It looks really fantastic. Can't wait to see it. So anyone's welcome to buy tickets. I'll have a link on the next page for that. Will make it a little easier. I hope lots of you can come and join us and bring your friends and family. And then on Tuesday, May 23rd, we have our annual Kathleen's Cause Golf Tournament, which is at the Arrowhead Golf Course, sort of South Littleton-ish. It's a beautiful, beautiful course. Lots of great events going on that day. So if you want to just go to the last slide, I just blew up the QR code. So if anyone is interested in getting tickets for the movie on April 2nd, you can just sort of open your phone camera now and hover over the screen and purchase your tickets. Only about $22 a piece. So hopefully pretty affordable for everyone to attend. That's all I have for today. Short and sweet. Thank you all so much. Happy to answer any questions if there are any.
Great. Thank you so much, Kate. And thank you, Ellen. A lot of really cool ways to get engaged and involved, and really important to acknowledge those months and make sure that awareness is spread during that period of time. If we could go to the next slide, Jen. If you'll take a moment for me to indulge my sentimentality here, I had realized earlier at the morning webinar that actually on Tuesday was the 3-year anniversary that many of us at the department were sent home for a short period of time to work from home during those initial days of COVID. And then actually late next week will be the 3-year anniversary of the first webinar that we all did. And so 3 years on, really appreciate everyone staying engaged, everyone being a part of this conversation, sharing with your networks, voicing sort of the concerns that you've seen. I'll talk a little bit more here shortly about the PHE, but with that, I want to turn it over to Amanda. I just wanted to take a quick moment to recognize the fact that we are 3 years in, so pretty amazing, and thank you all.
Thanks for that, Colin. It's hard to, on one hand, it feels hard to believe it was 3 years ago. On the other hand, it's like, wow, it feels like it should be 10 years. I laugh thinking about all of our Friday conversations, and many of your names I recognize from the very beginning. So we wouldn't be able to do this without all of the collaboration and support we have with you all. So I also echo Colin's sentiments. Thank you. As well as, I don't know about you, but the spring forward finally hit me today. And so I am like struggling a little bit here to stay awake. But again, there's a lot going on with case management redesign and the work that we're doing. We have 2 pillars. And if we can go to the next slide, one of the pillars that we've really focused on is the care and case management system, which really allows us to build upon into 4 phases all of the work that we have planned. The new care and case management system allows us to consolidate 3 different legacy systems that our case managers are currently using. It also has a lot more sophistication in terms of the functionality that it will host and the automation to try to minimize administrative burden. So we've been working very steadfast to get this up and going. 2 weeks ago, the department met, and as excited and as close as we are to going live, we still need a little bit more time. There were 4 key areas that we had concerns about. The first being reporting. Our case management agencies, as well as the department, are reliant on several reports to be able to do billing, reporting, tracking for CMS, et cetera. And so we had actually this week 3 days of working sessions with our vendors to get the reporting completed so we can start testing and validate and do some mitigation there. The other piece that we are really working on in this last final push is data migration. So all of the information that's currently housed in those legacy systems needs to be migrated over and ingested into the new system. And so we're trying to make sure that we have all of the systems speaking well to each other so that information doesn't end up in random places. So that work is underway. There's also been, we have 5 outstanding defects that we are not able to come up with a workaround at this time. We do have a path forward for all 5 of those, and so they are in the process of being retested, but until those are remediated fully, we can't go live with the system. And then the last one is the call center operations. So we currently don't have a dedicated place for case managers to go for IT system troubleshooting. And so with the new care and case management system, we'll have a call center with 35 agents who will be able to assist with password resets, questions in terms of navigation, as well as other technical support. So the department is actively working with our vendors. It is our hope that in the coming week, we will have a new go live date. I will anticipate for you all, it is likely that will be in mid-April. So hopefully next week, we'll get that new date out to everyone and communicate more. So if we go to the next slide, on the policy and program side, the department's been working really steadfast to we currently have 3 different structures for our case management agencies and members to access services depending on which waiver and program they're receiving. And so in the future, the department will have a singular case management agency in 20 different catchment areas across the state that will serve all individuals, regardless of the program or the waivers that they receive. And so we have a request for proposals that was released, and they were all submitted Tuesday, February 28th. The department's evaluation committee will begin reviewing those proposals and has done that. There were 2 areas where the department did not have applicants for. This is in the defined service area 13, which covers Chaffee, Custer, Fremont, and Lake counties, as well as area 16, which is Grand, Jackson, Moffett, Rio Blanco, and Routt County. Because there is an insufficient time to resolicit this work, the department intends to enter into competitive negotiations with interested vendors that did submit a proposal for the other catchment areas. As an interested party that has already submitted a proposal, the department has reached out to inform them that we are accepting proposals through Thursday, March 30th, 3 p.m. Mountain Time. So we do anticipate that we will have applicants and awardees for all catchment areas across the state, and we'll make those notice of intents to award in late May or early June. A reminder to everyone that the Office of Community Living, myself included, and my team, we are not able to speak about the RFP process or answer those questions. And so when we do get those, we forward them over to our friends in procurement. But anybody who does have questions, you can see the hyperlink there at the bottom. That is the best place to send those questions to. All right, next slide, please. All right, shifting over to the PHE. And, one of the things is during the public health emergency, the department has been able to leverage what is called the Appendix K to get some additional flexibility to really ensure that health and safety and meets the needs of our members throughout the pandemic. And so we had I can't even remember, Colin will tell us how many Appendix K authorizations we had throughout this pandemic to really make sure that the needs were being met. So some of them we were able to keep and work through our federal authorities, and some of them the feds will not allow us to continue. So as it relates to case management, the department will no longer accept verbal authorizations and signatures beginning November 11th. I am happy to share that we are able to keep the digital signatures. The other piece is virtual case management activities will end as well on November 13th. Case managers are required to perform the level of care screen, also known as the 100.2, in person. The department is currently working with CMS on allowable post-PHE virtual case management contacts with members, specifically around monitoring. but we will have more information as we get those approvals from CMS. And I just want to share, we have always been told by CMS that the annual assessment or new assessments will always be required for to be in person. And so that we've been really clear in trying to communicate that all along so that we didn't have any disappointment when we get to this time. We've heard from members and from case managers that there are the virtual space that makes sense and is really helpful for them, which is why we've worked really hard on the monitoring and some of those other contacts. Lastly, as it relates to the PHE End related to case management, we are working very closely with our eligibility partners on the closure process for members who have been locked into their waiver program. We will have a memo coming shortly, as well as host a webinar where we can sit down with case managers and answer questions and talk through what that will look like. Colin, I think I'll turn it back to you.
Sure. Thank you, Amanda. If we could go to the next slide, please, Jen. Before I turn it over to my friend Mark Williams with our comms office, I wanted to talk a little bit about some of the services that are part of the Appendix K and are going to be stopping here in the near future. And so at this point in time, the public health emergency, as I know all of you should know by now, will end in May. However, with the Appendix K, to which what Amanda had said, we're able to it's a vehicle to use to get flexibilities in our home and community-based waivers. That will actually, that is allowed to go an additional 6 months. So that will not end until November 11th of this year. So we have a longer runway for that. And so there's sort of two categories of flexibilities that will be ending. The first, these are our telehealth options that we've provided for certain settings, certain services. And what we've heard and what we've seen by either utilization or through conversations with you all is that these probably should go back to being in person, that traditional way. The flexibilities that we've put overall, which I would say through the 17 different Appendix Ks that we've done, which is, I know, one of the tops in the nation. We've done 17 different amendments during the last 3 years or so. So huge kudos to that team. But with that, we've also incorporated over 30 different flexibilities for many different services. So I know early on it was around dehabilitation or adult day, doing that remotely. So we've incorporated a lot of that, but some of these things will be ending. So as you can see, day treatment, pre-voc, and behavioral services, line staff, the last two for SLS and DD, and the first one for BI, those will no longer have a telehealth option come November 11th. The latter two, Community Connector for CES and CHIRP, and Homemaker for CES, will no longer be able to be rendered by family caregivers or legally responsible adults. And that is actually a federal regulation that is within the Centers for Medicare and Medicaid Services statute and corresponding regulation. And so that is a decision, despite talking with them and trying to look at some flexibilities there, that is something that we are not going to be able to continue come November 11th. So our plan right now is, because we have that additional sort of almost nearly 8-month runway, we're working very closely, or we'll be working very closely with our friends in case management, reaching out to different agencies, trying to see how we can get support for those families and those members who may be facing sort of a reduction in services or maybe not have that caregiver involved. So really trying to expand who can render those services, look at new agencies and bringing them in. So a lot happening there. In terms of communication around that, Mark will talk a little bit more about the broader communication plan for our unwind and overall kind of eligibility components of the public health emergency. But our plan is to get some specifics out around these things here in the next several weeks. So keep an eye out for that. And with that, I will turn it over to Mark to talk a little bit more about what we're doing with the unwind.
All right, thank you, Colin. Good to be with everyone this afternoon. My name is Mark Williams. I'm the Public Information Officer at the department, and everybody in our comms team has been working for months to get ready for the end of the continuous coverage requirement, and it is here. So literally yesterday, today, and tomorrow, The first renewal cycle has begun with auto renewals, also known as ex parte. And we expect that approximately 30% of our members will be auto renewed based on information we already have on file for them. Otherwise, renewal packets will be sent through the mail, and they should start to arrive in folks' mailboxes early next week, Monday, Tuesday or so, depending on some of the challenges Postal Service is having with staffing and what have you. But it's important to note that when we go through, pardon me, the renewals, not everybody, not all 1.7 million members covered by Medicaid and CHIP in Colorado will be renewed at the same time. Each member will be renewed based on their enrollment month anniversary. So the month that they initially enrolled in coverage is when their renewal will take place. We expect that we have planned rather to take 12 months, 14 if you consider noticing, to get everyone renewed. We expect that probably 80% of our members will maintain Medicaid coverage, but we've got about 325,000, or we estimate a little more than 325,000 are likely to transition off Medicaid due to their circumstances. They may have gotten jobs where they have employer-sponsored insurance available to them. They may be over income now. They may have turned 65 during the course of the pandemic and are now eligible for Medicare. So there are some other options for folks that we'll talk about here in a little bit. But those renewal packets are on their way out, and the deadline, if you will, that we're asking people to fill out, sign, and return to us is the 5th of each month. So people's eligibility end on the last day of the calendar month. And so in the case of our May renewals that we're beginning now, we're asking that folks complete them, sign them, and get it back to us by the 5th of May. If we can move to the next slide, please. So we have created a number of communication resources to help raise awareness around the end of the continuous coverage period. So we have created, we have gone back and forth on this a little bit, candidly. We have web pages that are geared more toward providers and to stakeholders and to community partners to help us get information out. And then we also have web pages on our healthfirstcolorado.com website that are geared more toward member-facing communications. And as we've done presentations like this and talked with other groups, we find ourselves talking about this web address, that web address. So what we decided to do is to create a front door, if you will, where everybody can come in through one door, and that web address is keepcocovered.com. And once inside that, on that web page, there will be two places that visitors to the page can click on. And you will, if you're a stakeholder or a community partner, you'll click on one box and you'll see a bunch of information that I'll talk about in a moment. If you're a member, you click on another box and that will take you to our more member-facing pages. But for community partners, stakeholders, providers, one of the things we have done is created a series of toolkits with a variety of messaging tools about renewals starting back up and the need for people to take action. So the first campaign we rolled out was update your address, and that was literally to encourage members to update their contact information with us. As you know, our population tends to be a bit more transient, and they may have moved over the course of the last few years. They may have a new email address, they may have a new phone number, and so we've asked and promoted that folks get in and update their contact information and also opt in for electronic messaging, be it text messaging or email messages, just because that they are quicker and a bit more responsive. The other thing the other toolkit we rolled out was the renewal education process, and it's a little bit of what I've already talked about, what that process looks like and how to go about it. And then right now we're in the take action on your renewal toolkit phase, where it is time to take action. That if you get that packet in the mail, or if you choose to go on PEAK, the co.gov/PEAK, there's another web address that we've tried to streamline through our Keep CO Covered page, but people can update their information and also fill out the renewal packets online through the Colorado, through PEAK online rather. So all of that information is available on the keepcocovered.com. The other thing that we're going to be rolling out in probably about 2 to 3 weeks is a series of public service announcements. We have partnered with the Colorado Broadcasters Association to air 30 and 60-second radio spots on both English and Spanish radio around the state, as well as 30-second TV spots or public service announcements on the Colorado Broadcasters Association member TV stations, which frankly, the CBA represents every TV station, every radio station in the state. It's just another way for us to try to get information out to members to be on the lookout for these renewal packets and what to do with them when they get them. If we could move to the next slide, please. I had talked about when you go into that Keep CO Covered page that there is a box for community partners and stakeholders to go to. When you click on that box, it takes you to this page, which is our PHE planning page, as we have come to know it. And it is probably for this group, this is one to bookmark for your own use. Pardon me. It has all of the toolkits that I've been talking about, as well as other tools like monthly newsletters, where we'll share any new communication tools that we develop, along with FAQs and answers on a monthly basis. You can sign up to attend quarterly webinars, where our eligibility and communications team will provide the latest information, reporting, answering questions, etc. Share out any kind of new communications collateral that we have to share, and basically get feedback from you on what do you need, what works, what are you hearing in the field, and what we can be developing to try and help get this information out. So we have the next webinar we have coming up is on the 26th. We encourage you to join that and listen in for new information. As Colin mentioned, the communications on the Appendix K information, we frankly have been focused on just trying to get what I have just told you about out the door, and then we're turning our attention to that Appendix K info that will be coming in the next couple of weeks. And then if we can go to the next slide. If you have any questions from a communication standpoint, you are welcome to reach out to myself or my colleague, Allison Ledden, and we will be certain to get back with you. And with that, I'll take any questions that folks have. I don't know if someone's been monitoring the chat. I have not, but if there are questions, please let me know.
I don't think there's anything in the chat for you, Mark, but we'll take a moment here and see if anyone wants to come off mute and ask a question.
I must have just been so thorough and clear.
I think that was it.
I think that was it. Very well. Well, listen, thank you, folks. Like I said, you've got the email there. Don't hesitate to reach out if we can be of any help. Have a good day.
Thanks, Mark. All right. If we could go to the next slide, please, Jen. We could go to the next one if that's okay. All right, so wanted to take a moment or two to, I think, both celebrate and then update where we're at around the community-based settings final rule. We are really at a pretty significant point in this journey, which is slightly over 9 years as of today, with tomorrow being really the last day that transition period, that folks are eligible for that transition period that I'll talk about here shortly. And so just wanted to do a quick summary here, because I think it's powerful to understand all of the things and how they fit. And so the HCBS final settings rule, or the final rule as we've come to call it here in Colorado, guarantees community integration for our members. It requires that they are able to have private communication. They have control over their personal resources. They have individual and informed choice about what their options are. They have privacy, dignity, and respect. They have freedom from coercion or restraint. They have the ability to have autonomy and freedom over their scheduling. They can have doors, locks, and keys. So being able to have that privacy, be able to have visitors at any time. They have access to food at any time. Things have to be accessible to them. They have choice of a roommate. They have choice of decorating, and they have protection against eviction. I know many of you, this is obviously the provider webinar. I know many of you are very familiar with that, and it has been a journey. I appreciate everyone's hard work towards this. It has been 9 years, as I had mentioned, to almost the day in which we received the guidance from CMS and had to come into compliance with that. And so when that first started, it was 5 years to demonstrate compliance. That then went to 8 years, and then it was 9 years, and that additional time. And so I know many of you had some questions about, what that looked like. I appreciate everyone's hard work this fall to come into compliance if they weren't part of that cohort of people who had that additional time. And so really right now, what we're looking at is a pretty amazing accomplishment. We were the first state in the country to receive approval for that corrective action plan. So we are looking really good for tomorrow. So I wanted to provide some context and sort of updates about where we're at overall as a state. If we can go to the next slide, please, Jen. So we have obviously made some huge strides towards statewide compliance with the federal rule. Again, this reflects enormous contributions by you all, showing up to those meetings, asking those questions, really helping us understand from a provider perspective, and helping your members voice their perspective from the member perspective about what it actually looked like in reality for some of these settings. It's one thing to read it in paper or get a notice from CMS. It's certainly another to see that in the community. So we appreciate everyone's patience, thoughtfulness, and collaboration on that. As we know that you've done a lot of that heavy lifting as providers, I also wanted to shout out our case management agencies, the support and coordination that they've had identifying some of those settings, or at least members who are in those settings, keeping everyone updated, giving that choice to many individuals, walking them through what that meant. It's been critical to have their voice in that conversation. So we wanted to say thank you to them. And then finally, thank you to CDPHE for all of their hard work. They really obviously have been the boots on the ground. So huge shout out to what they have done. But we believe the way that we've implemented this work in Colorado with your collaboration and partnership really is a way that honors individuals and is person-centered. And so while we're at the end of this transition period, it does not mean that we're at the end of the work by any means. It means that we've got some extensions that are under a corrective action. So we'll be looking at what that looks like for those specific settings. There's 58 settings that remain. 42 are receiving that additional time. 16 have chosen to stop providing HCBS, which obviously we're sad to see them go. But we do believe that the group of providers that we have, new providers coming in on a daily basis, we have a lot of energy going towards that. So appreciate that. So like I said, it's not over. We're going to continue the monitoring around that. We have DPHE as part of that conversation, making sure that there's no backsliding or any kind of return to pre-final rule behavior. But really just, again, wanted to take a moment to acknowledge all the hard work that's gone into this, all the frustration that many people have had working through that. So please give yourselves a hand. and huge props to all the teams and all the folks that have been a part of this. So thank you. And with that, I'd like to turn it over real briefly to Candace Bailey, who's going to give an update on private duty nursing.
Thank you, Colin. As Colin said, my name is Candace Bailey, and I'm the HCBS Division Director. And I just want to echo congratulations on the accomplishments of coming to the 9-year point of full implementation for the HCBS final settings rule. It is a really, really big accomplishment and something that every single one of you should be proud of. So congratulations to all of you. So I'm here just to give a really quick update on private duty nursing and the benefit and kind of where we are today. So as many of you are aware, we instituted an administrative approval process back in October of 2022. And that process is actually ending April 2nd of 2023. So coming up here in just a couple of weeks. During this last month of the administrative approval process, we are working on getting all determinations set. And so what that means is for everybody that has a request that is pending, everybody that has had their provider has sent in a request, determinations are going to start going out. We've already sent out over 200 letters to members to let them know whether or not the request that their provider made was approved or not. Denial letters are going out. So the intent is that everybody will have a determination letter in their hands prior to April 2nd. We're continuing to work with providers to make sure that individuals are receiving appropriate services so that individuals get the proper care, how they need it, when they need it, and making sure it's the right level of care. If you have any questions specific to this or any of these processes or about this benefit at all, please feel free to send an email to the home health inbox. So it's homehealth@state.co.us as stated there on the slide here, and I'm happy to take any questions. And it looks like we've got one from Jennifer here that just popped up. Okay, so the question is around some CCBs say that you can access PDN and the DD waiver residential services at the same time. Others say you can't. So this is a really good question. And so, as part of the developmental disabilities waiver with the residential services, it's a per diem service. And so what is built into that is most of the care that is needed by an individual. However, there are some exceptions, and private duty nursing is one of those exceptions. And so the rates currently do not actually meet the needs for a higher level of a private duty nurse that needs to go into the home. And so we actually can, as long as there's no duplication of actual tasks, things like that, we can allow in certain circumstances private duty nursing at the same time as the DD waiver. And if you have any specific questions on how that works, please don't hesitate to reach out to that home health inbox and we can work with you. Any other questions on this? That's a great question. Thank you, Jennifer. Oh, Irina, great question. So Irina's question is if there's going to be additional stakeholder meetings related to the review of PDN rules and regulations, and there sure are. We are excited to have many months worth. I think the next one is in April, actually, towards the end of April is when the next one will be there. It should be on the calendar already, but we will double check and make sure that it is on the OCL calendar. Thank you so much, Colin. And there's the private duty nursing website that Colin just put in the chat. We have all of our announcements that are posted there, including upcoming meetings, things like that, past meetings, past slide decks, and anything that you can imagine, FAQs. So that's a really good resource. Any other questions? Not seeing or hearing any.
Great.
Turn back over to you, Colin. Thank you.
Thank you, Candace. Again, I would strongly encourage, especially those home health agencies, that homehealth@state.co.us email address. Much like the HCBS email address, we do have multiple people checking that inbox. So if you have any questions, please use that as a resource. You will get a response in pretty quick order if you email there. So go to the next slide, please, Jen. Wanted to spend just a few minutes on some budget and legislative updates. I think I have, like I mentioned earlier, some good news for folks. So first and foremost, and sort of, I think excitingly, the JBC last week decided on a couple things. in addition to supporting our budget amendments and really the bulk of what we had asked for as a department, all of the things that we had asked for in OCL, they actually went above and beyond that call. And so what had been put forward in order to, kind of fit everything else that we were doing, the targeted increases for the new base wage, there was only a 0.5% increase across the board for many providers. And while we believe that most of the home and community providers were targeted as part of that base wage, there were a couple services that I know weren't included, and we had to make those hard decisions. So really appreciate the Joint Budget Committee making that decision with that additional 3%. What's great about that, though, is that that 3% is iterative, which means that that 3% will actually be on top of the base wage. So there's a slight reconsideration of what historically we have said, which is, targeted rate increases do not get the across the board. Well, because this is the base wage, it's not actually considered a targeted rate increase in that regard. And so that monies will be made available on top of that. So for example, if you go through and look at personal care, let's say I think is 5.9%, there'll be a 5.9% increase on certain personal care. That would actually go up to 8.9% increase for that line item. So there's obviously more to come with the rate sheets. The R7 is now a little outdated, obviously, with what those increases will look like, because it only contains the new base wage increase. So bear with us while we wait through this process. Obviously, and I have a disclaimer at the end, the session is not over. There's a lot of activity left to happen. I know that Emma and other folks are at the Capitol trying to make sure that people know how important this work is, but nothing is said and done yet, but I think a really good sign for OCL, good sign for our members, and certainly good sign for our providers. So with that, we also saw our alignment of the non-medical transportation rates to align those. That was approved. What that does is that targets the DD and SLS waiver NMT services in particular, and raises those up pretty significantly. In some cases, there's going to be, I believe, a 35 to 40% increase for some of those tiers. So great news there. And then approximately 18%, and again, this is very specific to what level we're talking about, what CIS level we're talking about, but the average is about 18% to group residential services and supports, or group homes, or GRSS, however you want to refer to them. And so I think great news there. That was one of the areas that we had originally targeted rates. So those last two things, NMT and GRSS, those do not get the 3% because they are true targeted rates. However, our goal is to make sure that we had put that effort forward in trying to get those things aligned and brought up, and acknowledging some of the concerns around both the workforce, but I think overall equity within the system for those two services. So there's also a set aside for the nursing facility rate increase. We're working on a bill here at the department with the nursing facility industry, Speaker McCluskey and Senator Zenzinger, to try to bring a lot of innovation in that space. And then fundings for providers, sort of already talked about this, but to be more specific, we're bringing up or asking to bring up that statewide new base wage to $15.75. And then in Denver, we'll bring that up from $15.87 to $17.29. So I think great news there, trying to recognize the increases both within Denver, but I think the overall impacts of inflation in the direct care worker crisis, frankly, just the worker crisis in general. So great news there. We can go to the next slide, please, Jen. Another, I think, really amazing thing, and I know many of you have been following along for a while, but we put forward a budget amendment, which is BA 07 there, to address some of the Department of Justice findings. And so as part of that, there were a handful of things that we had identified we needed additional funding for. One was increasing our transition support services, looking at diversion and rapid reintegration for people reentering or going into the community from institutional settings. And then really significantly in terms of the work that's been ongoing for nearly a decade is community first choice. And this will expand access to many different people. Participant direction will be able to expand to new waivers that have never seen it. And so exciting to be able to get that approval It is just sort of the first or the next first step, I should say, in the process. If there is interest from this group, we do have a CFC council that has a lot of engagement that meets quite frequently. A lot of the decisions are being made right now, so I'd encourage you to get engaged there if you'd like. And then our R10 was actually to expand respite services for children enrolled in CHIRP and CES to include skilled and therapeutic respite, recognizing there was a gap within the respite continuum or respite spectrum of care that we needed to address. So really excited to be able to expand those services and get some new specialties in there. And then finally, and last but not least, very excited to have the JBC approve an additional increase to the TCM rate up to nearly $150, a very specific $149.17. So great to see that increase there. And this is obviously just a big step. So here's the disclaimer, this is a big step. This is not the last one. This will change, likely some things will change, some specific numbers might shift a little bit as we get closer to the end of session, as more bills come forward with a fiscal note. So keep that in mind, but really appreciate everyone's passion and engagement. And I know how amazing you all are talking to your legislators and going to the Capitol. And so another, I think 54 days, 53 days, but who's counting, left in session. So please make it known, especially I think there's, the Brain Injury Awareness Month, then you have IDD Awareness Month. Those opportunities I think are great to just reiterate how critical some of these funding lines will be. So some updates there. And I see a question from John. He asks, if I've heard correctly, the service is getting a targeted rate increase, NMT and GRSS aren't getting the 3% across the board increase. Are they getting the base wage rate increase plus the targeted rate increase? No, John, so the TRIs are themselves the rate increase. So they're not getting that that variable rate for the new base wage. That is a separate and apart. But to that end, I think the goal is with bringing that up, we're sort of going well beyond those two things to make sure that those increases for those services are pretty significant in that regard. I see Ellen is saying, hey, Colin, our understanding is that the JBC approved the 3% on top of the TRI for the GRSS and NMT. Okay, that would be news to me, but certainly wouldn't be the first time that I am not completely in the know on some of these things. So yeah, if you want to shoot me over the staff document, I'll make sure to circle with our budget director to make sure that is also her understanding. That was not when I spoke with her last week, but I know that JBC has gotten in the weeds on some of this stuff, so that very well might be the case. So if I'm wrong there, I apologize in advance. Any other questions, thoughts, corrections folks would like to make before we move on? Anyone want to ask what retainer payments are, just for old time's sake, as we're at the 3-year anniversary here?
That was a good joke, Colin. I know everybody's laughing.
Just throwing
really
things out in
hard.
the ether this Thursday afternoon. All right. And yes,
I think they want us to bring back Fridays.
It does take a village this year, Ellen. So thank you. And I appreciate all the work that you guys are doing over there. So if we could move on to the next slide, Jen. So speaking of respite, we know during COVID that caregiver burnout, family caregiver burnout was at an all-time high, is at an all-time high. I shouldn't say was, is at an all-time high. So we really would like to understand better the gaps that we have in our service, what this looks like in terms of how families use it, what is needed out there to the gaps piece. But I think also, as we had previously mentioned, are there different ways that we can provide respite, or as a state allow for respite to be rendered? So that will be going out. Please share it with your networks. Please take just a few minutes to complete that. We would love to have more families and caregivers actually fill this out. Hearing directly from that, it would be really helpful for that information to get to us. And then if we could go to the next slide, please. The non-medical transportation survey, I actually got this one the other day, so I do know it's in the field right now. I'm not sure if it's gone out to everyone yet, but please also take a moment to fill this out. There's so much going on with transportation. I know a lot of you were involved in the conversations last year. about getting some new carriers potentially in the system, trying to diversify who can provide NMT. So, when we're looking at in our National Core Indicators Survey, which is surveys from our members, we always see 1 and 2, depends on the year, is housing and transportation. And so we really would love people to give us feedback on the transportation and benefit here, as well as get involved in that ongoing work that we have around transportation. So please share with your networks, take a few minutes to fill that out. We would be greatly appreciative. And if we could go to questions, I think we're doing okay on time. So, all right. I stand corrected. Thank you, Ellen. I guess that, John, I stand corrected. The 3% goes to those targeted rates. So that's great. Very glad to hear that. That will make things a lot easier for our rates team, frankly. So good news there. Thank you, Ellen. And yeah, let's confirm together. I'll circle with you offline. And then I see Jennifer asked, does the survey address respite / PERS in residential settings? Yeah, so I mean, I think to your point, maybe you're asking about host homes in particular. If I'm incorrect, then I apologize. But yes, I think that the goal is really looking at respite as it pertains to the entire system. So if someone is at home and maybe needs to go into a residential setting, or they're in a host home and they need a respite provider, or they live with their family and need respite. So I think it's broad enough to try to get perspectives from all of those different components of someone or a family or a unit of folks needing respite. So I think that would take into account all of those things there. But great question. Any other questions before I jump into the housekeeping? They're so quiet today. All right, let's move on, Jen. So if you could, please take this 60-second satisfaction survey. It makes our staff very, very happy who run these things. Jen and Max and everyone else gives us an opportunity to see what we could be doing differently, how we can change things to be more effective. So please go ahead and take that survey. Max, as always, on the spot with the link in the chat. Up next, in terms of webinars, we have our ARPA quarterly update on May 18th. So again, we're rotating ARPA and OCL kind of general updates every couple of months, every other month, depending on when the month is. We are going to skip April and then come back in May after the end of session, do an ARPA update to all stakeholders. Remember, we're just doing those the single meeting that day. And then we'll be back in June with OCL general updates. I'm sure we'll do a long summary of sort of what all happened during the legislative session. We'll go over rates more specifically, some of the things there. And then the bottom link there, and I know that Max had thrown that into the chat. Please go ahead and take a minute just to suggest a topic that you may want to see. We are always looking to try to diversify what we're talking about. We love bringing in new people, so it was great to have Ellen and Kate today, but we're happy to bring in the BHA or the Behavioral Health Administration or CDPHE or CDHS, so we could talk to different executive agencies. We're happy to get outside contractors to come in too. So take a few minutes to go ahead and provide some suggestions there. And then last but not least, please stay engaged. I was reflecting this morning. I probably on a weekly basis get an email or a forward saying, how do I get on John Barry's email list? Well, it's right there. You can sign up to do that. So if you want to download the webinar, all of those links will be active. I think a lot of those, especially the stakeholder engagement calendar and the memo series, are going to be great bookmarks to have. We do a lot of updates on various policy within our memo series, so keep an eye out for that. And then I think we have one question in the chat that I'll get to. Any update on ARPA dollars to digitize grant awards? Jennifer, I can't kind of get into hyper specifics on that. I know that they're in the process of selecting sort of the final awardees. So I know there will be more to come on that particular thing. So keep an eye out, and thanks for your patience there. And finally, Thank you all. 3 years in, really, truly, again, appreciate everyone's engagement. You guys have been so great through this all. The collaboration, the mutual respect, just the support amongst this community has been fantastic. So thank you all. Have a great rest of the week and have a safe weekend. And we'll see you all soon.